Digest, brought to you by Equity.
Domestic and global demand for personal protective equipment PPEs in healthcare facilities has continued to increase since the onset of COVID-19 pandemic, leaving healthcare workers who are on the front line exposed.
Solidarity forever. Solidarity forever.
The shortage that also hit home saw a number of healthcare workers down their tools in protest of what they described as being sent into a battlefield without any armor. To help boost supply of these vital commodities required by healthcare professionals, different stakeholders came on board in an effort to ensure the healthcare workers were and are protected as they tend to patients.
COVID started last year in March. This was a new thing. There was no PPEs in the country, and we found that most merchants went to the market and brought very many qualities of PPEs. Most of those were not good quality PPEs, and there were qualities that would expose the clients.
With the resurgence of the condition, the numbers have started going up again. But as a facility, we have tried as much as possible to accommodate as many Kenyans as we can, both in the isolation areas and in the critical care areas of ICU, HDU.
It is not safe for the patient and even for us when we don't have the PPEs, because you are psychologically, you will not attend to the patient fully because you are already afraid that you can get infected. But when these supplies are there, you will fully go to the patient and confidently assist the patient.
Let's take a look at how this simple but noble gesture is helping save lives in health facilities that are beneficiaries of the Equity Foundation. The COVID-19 pandemic has made it clear how important personal protective equipment PPEs is for the safety of people, especially frontline healthcare workers who are at much greater risk of acquiring the infection while at work. Whereas healthcare workers rely on PPEs to protect themselves and their patients from being infected and infecting others, the emergence of the pandemic and subsequent surge in the number of infections reported globally worsened the demand for supplies to effectively combat the virus that penetrated the Kenyan borders in March 2020. Kenyatta University Teaching, Referral and Research Hospital, being one of the designated COVID-19 facilities, bore the brunt of the increasing demands for PPEs in the country. To enable its healthcare workers to attend to the huge number of patients who continue streaming into the facility for the much-needed care, PPEs were going to be critical even now when the country is battling the third wave of the virus.
We have probably received the highest number of patients in this country. The numbers have been were very, very high at one point. We were hosting up to 450 patients. Then after the containment measures which were done and the government took good actions to try to control the pandemic, the numbers went down within the country and even within the hospital. The numbers became much fewer. But of course, with the resurgence of the condition, the numbers have started going up again. But as a facility, we have tried as much as possible to accommodate as many Kenyans as we can, both in the isolation areas and in the critical care areas of ICU, HDU. We have expanded our facilities. Our ICU from the initial capacity of 24 patients, we have expanded it up to now. We are able to accommodate up to 40 to 50 critical care patients.
Some people may wonder, why are you saying COVID is expensive? The reason why is because of the infection and the magnitude of the mortality it can cause. And you have to protect yourself. It's not a normal walk-in situation where you'll go with your own dress and be able to just go and greet the patient and treat the patient. This is a situation where you have to don so that you are able to protect yourself and be able to assist the patient. So you find that this patient needs to be taken care of by the nurses and the doctors in 24 hours, running without fail. And in our hospital, Kenyatta University Teaching and Referral, we make sure that there is no single point that the patient is left alone. Nurses and doctors are in the COVID area 24 hours, any time during the day. This calls for the PPEs to be available for them to be able to wear them 24 hours. Now what happens is that not only one nurse goes in and stays for 12 hours and gets out and another one goes in. We have to don in teams and in turns because as WHO says, it's a maximum of 6 hours exposure. So what do? After 6 hours, you have to let your members come in. They also have to don. So if it was a normal situation, you could say that you can use one PPE the whole day without wearing the mask and you just be safe. But here you have to fully equip yourself. So you find that in average, you can use even close to 50 PPEs in a 12-hour shift. Because you find that to go and take care of patients, probably you are 25 people getting in 12 hours. Another 25 getting in 12 hours because our bed capacity is 24 bed. So we are talking about 50 people getting in 24 hours. And that is minus someone else who might come in from another department coming to assist, like doing x-rays and the other investigations. So I can testify and say that without PPEs, managing COVID is very hard and it will be very difficult.
Jacqueline Tindi, a critical care nurse in charge of the facility's intensive care unit, knows all too well what an influx of COVID-19 patients mean not only to the healthcare systems, but also to her health as a healthcare provider at a time when PPEs are a first line of defense against the virus.
Initially, we didn't have so many patients, but when it came to January this year, the numbers have increased again. So it was very tough because we had to wait for procurement to be done, signing of LPOs, then the things to be delivered. And this one could take a length of time. And, it is not safe for the patient and even for us when we don't have the PPEs because you are psychologically, you will not attend to the patient fully because you are already afraid that you can get infected. But when these supplies are there, you will fully go to the patient and confidently assist the patient and even encourage the patient that it will be well.
One of the key issues for healthcare systems in the world during this COVID-19 pandemic has been lack of sufficient personal protective equipment for health workers. And Kenyan hospitals have not been spared of this shortage either. So, how has this facility managed to bridge this deficit?
We are lucky that we have partners, and one of our partners is the Equity Bank Foundation, who have been gracious enough to be supplying us with most of our PPEs. So they supplement what the hospital has been procuring, and that ensures that we have continuous flow of PPEs, ensuring that at no given time do our healthcare workers lack PPEs.
Once we get the PPEs, they are taken to the central stores and they are registered within the central stores as a part of the consignment in the stores. And then based on the staff needs, the PPEs are distributed. So we have a system where we know the numbers of patients, we know the numbers of staff in the various areas of the facility, and then now we use that information which we have to distribute the PPEs within the facility.
We have come up with a document where we track all PPEs. It is called the Facility Consumption Data Report. In this tool, which we have generated, is that every day that we are giving out the PPEs to each ward, so we record everything that we give out, we record everything that is coming in, and therefore at the end of every day we know what is our daily consumption, what is our balances, and using the months of stock where we calculate based on what we are stocking and looking at our consumption, we are able to see how much are we holding in terms of stock. So we have a reorder level where if our stocks go below less than 1 month of stock, then we place an order to ensure that at any given time we have a buffer stock of 1 month of stock.
According to Dr. Edward Maina, who chairs the hospital's COVID-19 Commodity Security Committee, the partnership has seen the facility enjoy sufficient supply of the crucial commodities to help attend to the huge number of COVID-19 positive patients who throng the hospital for treatment.
The committee has a link with the Equity Bank Foundation. There is a system where there is a committee that sits at Equity Bank, which is run by a medical doctor, Dr. Joan Coril, and we liaise with them. So anytime we have an order to make, we just do a requisition to them, and within 2-3 days, they have supplied the quantities that we had requested them for. And then for anything that we need supplementation, we request the hospital to procure, and the hospital management has supported us very well because PPEs procurement has been put on the forefront, and I can clearly say that we are commodity secure in terms of PPEs for our healthcare workers.
When we're done with these full PPEs that we have given, our worry is not even we're going to get infected because we know we are safe. So what we do, we go in there, assist the patient with the aim of saving lives. Any point of entry the patient comes, you are ready to receive that patient because you are fully equipped. You are ready to save that life. You as the medical practitioner, you're not worried that I'm going to get COVID.
Without a secure supply chain, experts say the risk of running out of PPEs is high. And with partners coming on board to boost the supply of these vital commodities, health facilities remain afloat and health deliveries uninterrupted.
The support which we have got from the Equity Foundation has been crucial in helping us to manage costs. Because as you are well aware, the COVID pandemic came in with a lot of economic repercussions in the country. And this also affected the purchasing capacity or the disposable income from a lot of Kenyans. And also that led to difficulty in payment of bills. So we are really, really grateful. The support which I've got from Equity has come in a big way, and it has really helped us manage the costs, which would now allow us to have very, very subsidized costs for care. As you know, taking care of COVID patients is very, very expensive. At one point, I think it was being estimated that it costs up to 20,000 shillings per day to take care of one patient. But with the support which we have got from the partners, particularly Equity Group, it has allowed us to charge subsidized costs to our clients.
The supplies have been really coming when it's really needy and in the quantities that have supported the facility. You can imagine a facility of this magnitude would be really strained because we are supporting over 1 million residents from the county and from outside the county as well. So that support has been very instrumental in terms of beefing up what the hospital would generally get from the Kenyan Medical Supplies Agency, KEMSA, and other sources and other donors as well.
Experts say the protection provided by PPE depends on human factors, including proper selection and use of the PPEs. So, how was the quality of the PPEs to these facilities verified?
Personal protective equipment, specifically for COVID, you need several things, and those are a must. You need gumboots. If you don't have gumboots in a place that is scarce, you must have shoe covers. where you have to put on your shoes and you have to make sure that you have shoe covers. But ideal way how we practice in Kenyatta University Teaching Referral, we have to put on gumboots because the safety of our staff comes first. So with the gumboots, you have to have coveralls. So these coveralls are the ones that you put and you cover the gumboots with, and they are able to cover your head also.
What we did as a committee is to sit down and come up with the specifications of what is acceptable to us. And when Equity was starting to give PPEs, they were gracious enough to come and ask us what quality did we need. So we gave the specifications and they executed that. And what they have been supplying us has been of very good quality. It is what we have been using. And they have set the market for the PPEs, where even other suppliers who would want to supply us, then they have to achieve the specifications that are already being supplied by Equity Bank Foundation.
After identifying the factories, the manufacturers who are going to manufacture those PPEs, we made numerous visits to those factories to ensure that what they're producing is what we prescribed insofar as quality control is concerned. So, because sometimes you may find that what you are being shown is not what is being produced. So we kept on making numerous visits to those factories to ensure that those PPEs were of the standards that we'd prescribed.
The quality that came in and the feedback we are getting, because the quality we came up with was lighter PPEs, which one could be able to stay with. And we are also giving examples of, like, for example, those people who are working in northeastern and very hot areas like coast. So they were able to appreciate, they really appreciated the type of PPEs that we came up with. The other thing, they were also durable. They were not just the previous ones used to get torn very easily. These ones could not get torn, and therefore they were assured of that safety.
Initially, we used to receive coveralls that were being procured. Probably they've been imported, and so we have to wait for them. And when they come, they were of different sizes. So you have to pick the size that fits you. So sometimes you will end up spending a lot of time checking for which size fits you and which one is better for you to cover your hair and all that. But this has come to the reduction or even the time for donning, because when you know that this is the coverall that I'm picking, it's going to fit me, you're not even worried about the timing. And sometimes we receive patients who need an emergency care in the COVID area. Like for example, like the anesthetists. When there's a patient who has an emergency intubation and our nurses or doctors inside there are calling for backup of assistance, they don't have to get worried looking for which coverall is fitting them and which one is not. They just pick one, they rush, they don, and that's it. So it really helps to save time. And also we used to have other coveralls which when you put on, you really sweat a lot. Because, you know, the heat that is produced through the wearing of all these gadgets, it really is uncomfortable. And that's why you cannot stay in for a long time. But when you have coveralls that are fitting you, you're able to reduce that amount of sweating that is caused through the movement and the tightness of the PPE.
Through the supply from Equity Foundation, which they have been supplying us, we have been having enough of them because they have almost they have supplied us more than 6 times on a different occasions, whereby this has been enabling us to give whenever our departments and staff need them. And they have been of much use because even currently they are the ones we are using within our hospital, and which is almost everything. They are just everything, assisting every department in running, even the masks that we are putting on, the gowns, the capes, all those things, including the gumboots, they are of much benefit to hospital.
All the comments, all the feedback that we have regarding any supplies that we have been getting, I relate to the coordinator who is based at the Equity Bank Foundation, that is Dr. John Korir, and they have been very good to accept our recommendations and to continuously improve on the quality of the PPEs that they are supplying to the healthcare workers.
There is no doubt that the COVID-19 pandemic triggered a global surge, leaving countries striving to urgently combat the disease amidst an upsurge in the number of infections that left most health systems stretched to the limit. Experts advise on the need for partnerships with the private sector in order to boost response efforts.
We come up with a common position and common way of doing things. Each of the corporates can find its own niche in how to fit in within the various needs to try to support the fight against the COVID pandemic. For example, manufacturing industries, are there ways they can come in with whatever they're manufacturing to support frontline workers? Commercial facility organizations, are there funding gaps which they can address? For example, in procurement, a lot of these things which hospitals might lack, especially in the counties. Media and communication
can achieve so much more if we collaborate with various partners who are in this sector and who are willing to help in combating the COVID-19 pandemic.
Kenya has unfortunately lost close to 100 healthcare workers to the COVID-19 pandemic. More than 3,000 others have contracted and survived the infection. These numbers without adequate and good quality PPEs would have been higher. With the current ongoing vaccination to check the spread of the virus, healthcare workers are guaranteed an additional protective armor against the virus.
It covers from the head all the way to the foot.
Gloria Milimu, KTN News.
You are watching Health Digest, brought to you by Equity.
Mama yao, angalia mikono yangu imeparara.